All right. I think we should start. And a very, very warm welcome to everyone. This is our third epic webinar. It's all in the acronym, and it's about the challenges of evaluating complex policy interventions. And many of you here have a lot of experience doing this, so we really look forward to the discussion and your insights. What we're going to do today is just present three different approaches for doing this, in the hope that this will stimulate some discussion about similarities and differences between those approaches. And maybe that some of you who have done these types of evaluations in the past can share your insights from those. So I'll kick us off, and then Sarah Dalglish and Carlos Grijalva Eternod are going to do bits of this presentation as well. And we'll try to keep to no more than 35-40 minutes so we have enough time for discussion. So we're talking about evaluating complex policy interventions. Can everybody see these slides okay?
Yes.
Fantastic. So it's helpful perhaps to start with common ground terminology. By complex, we really mean interventions that have multiple interacting components. There could be multiple actors, government, NGOs, other actors, multiple instruments, the law, funding, other types of incentives, and multiple layers. Some of these interventions could occur at national level, provincial or regional level, and a municipal level. So multiple interacting components. These interventions also often have unpredictable, non-linear effects. So a nutrition program, for example, that works in one state may not work in the same way in another state because of cultural, political, institutional differences. And these interventions, if they're complex, tend to be very context dependent, because again, whether they're activated or not can depend on institutional political support. And we often think about their outcomes as emergent. We cannot predict them fully because the interactions between these actors, these instruments, these layers can create outcomes that were unexpected. And so a common analogy for this is it's not like launching a rocket to the moon, it's more like raising a child where really the trajectory is dynamic, it's context specific, it's always evolving, and it's impossible to script fully. So this poses a particular challenge for evaluators, and it's not a surprise that people who evaluate complex interventions are often very frustrated with experimental evaluations, particularly randomized control trials, because the perception is that these methods often look for very clean, simple causal answers in situations where the effects are, in fact, often messy, interdependent, and very context driven. So in these types of situations, the recommendation is normally to put aside experimental evaluation or use it with other methods, particularly systems-based, realist, or mixed methods approaches. And these approaches are going to help us think about mechanism, context, and the way these interact to produce particular outcomes, not just average effects. And so all of these approaches have in common the fact that they are part of a family of theory-driven evaluation methods. And this is very obvious, I'm sure, to most of you, but in our world, we normally think about program theories or theories of change, and these tend to be setting specific. So they explain how a specific set of activities leads to a specific outcomes in a given context. If we want to abstract up from there, another set of theories that we could draw upon or construct are mid-range theories. And these are higher level and they deal with specific aspects of social life that are not setting specific. They can cut across different settings. So one example is the theory of social capital to explain how relationships of reciprocity influence different health and well-being outcomes. This is a theory that can be applied to many different kinds of settings. And then you have grand social theory, which is an overarching explanation for how society functions. And there are many of those But Marx's historical materialism theory is probably one that's quite familiar to all of you. So as we move up the chain of abstraction, we can go from program theories of change, to mid-range theories, and to grand social theories. So for our discussion on evaluating complex policy interventions, we want to look at three different types of approaches, and they're all theory-driven, but they use a theory and data collection in quite different ways. Another thing they have in common is that they all use a case study approach. And I'm going to hand over to Sarah to talk to us a little bit about what that involves, and the methods that she's most familiar with case study research. Sarah, you can just tell me to move when you're ready to move slides.
Thanks, Audrey. I think you can go ahead to the next slide. So yeah, case study research, as Audrey just said, is often underlies all kinds of explorations of complex systems, evaluations of policy, because the goal of a case study is to conduct an in-depth investigation of a bounded system. So that is a case. So it could be an individual, group, community, organization, event, or in this case, a policy or a policy process. The thing that is really powerful about a case study is that you are looking at something holistically within its real life context. So you're not divorcing it from everything that's going around it. You're understanding all of the, potentially social, political, cultural, everything that is surrounding the sort of events that are taking place, so that you can really have a holistic view. You're preferably using multiple sources of evidence because that's going to give you really the richest sense of the case. So if you're looking at, for example, qualitative case study methodology, methods that are commonly used are qualitative interviews, in-depth interviews, document analysis, focus group discussions, uh, direct observation of events. There's really many different participatory methods, excuse me. Really many different kinds of uh, data collection can be used to support case study analysis. And what you produce is contextualized understanding of complex social phenomenon. So you're really getting this high level view of what occurred. Case study research, you can look at a single case, a single policy process, multiple cases. You can compare one or more cases. You can do retrospective case where, for example, you examine something that happened 50 years ago or 5 years ago, or you can do prospective, where you're studying something that's happening now into the future. You can use process tracing or realist approaches to evaluate what's gone on in your case. And those are two methodologies that we're going to discuss later on this presentation. So I think probably everyone here is familiar with case study research, and probably understands why it makes sense to apply it to our policy research. But if you have any questions or comments, feel free to put them in the chat or raise your hand. Next slide. So I've put in a few examples of case study research just to let us conceptualize what that means for our type of research. One is an assessment of Thailand's universal health coverage scheme. Huge policy reform, extremely complex because it touched all parts of the health system. The goal was for everyone to have access to health coverage, which was pretty much achieved, which is incredible. The reform, as I said, extremely complex, embedded into the context. You can't think of this reform outside of the Thai context. Here's a quote from the report, which I've put a shot of the cover on this slide. The reform created new institutions and institutional arrangements comprising a multitude of interventions molded by a range of contextual factors. The complexity of this is coming out both in terms of what the reform was and the social context that it took place in. So in order to get a handle on this complex case and define the case, really, they came up with a conceptual model. Um, the findings, I'm just gonna, just as more for interest, honestly, is that universal health coverage was achieved, equity and utilization of health services were improved. There were very low levels of unmet need and medical impoverishment. There was an increase in government spending, not as much improvement of primary healthcare as anticipated. Basically, this was a huge deal for Thai society, and a really in-depth case study was needed to understand how it came about. So next slide, please. Don't be scared by what the slide looks like. We don't need to go into this in detail. What I really wanted to show on this slide is if you look at the yellow figure in the middle, that is how essentially they define the case. If you look at the red box in the middle, it's the universal health coverage scheme, and they conceptualize it through basically five steps, the policy process and system design, the contextual environment. These are the red numbered letters, the implementation process, governance, and impact. And then each of these five had little sort of sub studies. But what this I'm trying to show here is basically this is how they define the case, and they used all these different methods across these sort of subsystems, like in-depth interviews, document review. They made a chronology, and they really only used quantitative analyses for number five, the impact. And that's when they looked at large scale secondary data, databases, and quantitative analysis of macroeconomic indicators and things like that. So this is how they define the case, and this is one way to sort of break up a case to approach analyzing a complex system. Next slide, please. Another example, that was a single country case, just Thailand's universal health coverage scheme. This is a multiple case study analysis that I was involved in. It was looking at a policy for managing, oops, we got a little ahead. Audrey, thank you. For managing childhood illness in 6 African countries that you see highlighted there. So each case was a policy development process within each one of these countries. And there was a lot of variation in the extent to which the policy was successfully adopted and integrated into the health system. So again, this was one policy. You can basically see that blue document, WHO UNICEF document, that is the policy. But there's 6 very different cases in terms of how well it was integrated or not into the country's health system. So cross-case analysis found that there were some key determining factors, such as the trajectory of primary healthcare within that country, the nature of the community health worker cadres, things like that really influenced how well this policy was able to work in each of these countries. Across the cases, we also saw that the transnational evidence brokers and epistemic communities were really influential in to how the policy was sort of this global policy was filtered into national environments. So that's just an example that may be interesting for some of us looking at different cases, how you can draw together sort of similar policy ideas and processes, but which are articulated very differently in different environments. Next slide. This is my last slide. Just thinking about how this could work for us, EPIC. Each district or municipality will likely be analyzed as its own prospective case because it's its own situation, own actors, own context, and using cross-case analysis to draw broader conclusions about the interaction between our intervention and specific features of context. So what that requires is that we really understand the narrative of each case, what happened in each district, and then we can apply an analysis framework across them all to really draw out and understand features that either they share or the different that really determined the outcomes of our intervention. So a question that I'm not going to even try to answer, but it's something for us to think about is how would we, assuming that we have a theory of change devised by stakeholders in each locality, how would we work to synthesize or work across those? Because as Audrey pointed out in one of her earlier slides, that is sort of the lowest level, the programmatic or theory of change level of theory that will differ likely across each of our cases. So this is more just food for thought as we move forward and talk about some other evaluation methodologies. Over.
Thanks so much, Sarah. As we're moving on to an approach from political science called process tracing. And the reason we're talking about this is because as we were developing EPIC, so the policy intervention evaluation that Sarah was talking about, our funders, the NIHR, asked us to think a little bit more carefully about causal attribution within a case. So even if we have 10 case studies, how do we attribute specific outcomes to specific mechanisms or specific elements of context? And so we turned to political science and we were trying to explore process tracing, which is one of the most commonly used methods in that field. And Carlos has been digging into that. Carlos. You might need to unmute.
Thank you. Thank you, everyone. I need to learn how to use Zoom. I want to make a very simple clarification before we move forward. We haven't been using process tracing in our research, so I just wanted to keep an eye on that. It might just look a little bit weaker as a system because we have less experience with it. I don't think it should be just that way. So if we go to the next slide, Audrey. So just again, I mean, this is I'm understanding the process, and I want you to kind of take you to the ride with me, and I'm hoping that as I'm explaining to you, I'm actually explaining it to myself better. But process tracing is primarily a method that is focusing on identifying and testing causal mechanisms, whether linking a policy or event to the outcomes, and then again examining the sequence of how this evidence happen within a single case. So process tracing is very much about just one single case and is focusing primarily on how it works, i.e. the mechanisms. Next slide, please. So why do we need to use process tracing? Well, normally it kind of goes beyond that to the point of did it work? This is very common result that happens with a lot of RCT studies where we know that, okay, it worked, but then we never know really how it works. And I think this is part of that frustration that Audrey and Sarah had already alluded, that we really need to look into the mechanisms, and process tracing presents that kind of like element of just focusing on the mechanisms and by clarifying the causal change and trying to find how strong that causal elements might be. Next one. Okay, so as I say, primarily process tracing focuses on one single case. And this is very important to keep in mind because one of the things that it develops a very strong internal validity. So we know how things, at the end of using process tracing, you know how things work within that single case. We don't know whether that will be carried into other contexts because, you know, the external validity is not necessarily strong. Nonetheless, it's a process that could be used in multiple cases and is quite resource intense to be able perhaps later on to do comparisons of the different contexts. Again, one of the important things of process tracing is that it focuses on reconstruction sequences, and sequences is very important in this case. It's not just the appearance of different phenomena. They need to be kind of follow in a sequential manner. And next, please. So again, I'm putting here an image of a kind of like an investigator because this is a little bit what we're trying to do. You are trying to really focus on whether things can be attributed or not attributed to the phenomena that preceded it. And for this, you normally need to start first developing the theory of change, or developing and really have a clarity of the outcome that you are looking at. And once you develop your model, you need to develop really rival hypotheses that you will be testing. So you will need to have observable and testable observations. And then obviously the data will be gathered systematically. Next, please. So here is a visual of what process tracing is trying to do. So if you can see at the top of the image, you have the theoretical level. And this is very commonly observed also in RCTs, where either by design or by the collection of data and then inclusion within the statistical models, you try to eliminate anything that is marked within that black box between the cause and the outcome. Because what we want to know is whether the cause is directly related to the outcome, independent or outside of anything else that might be within the black box. Whereas with the process tracing, our focus is on the black box. It's about trying to find how an empirical manifestation from event A went to event A, B, and then C to the empirical manifestation of the outcome. Next, please. And here I give you an example. Again, this is coming from political sciences. The idea of the taboo of using or the negative view of using nuclear weapons, how that might affect policymaking. So the causal mechanism you just need to have, or in this case, the person that has a very strong belief in that taboo will normally use some sort of a speech during a table negotiation for using or not using nuclear weapons, and that speech might just create a situation of shame for using or suggesting the use of nuclear weapons. Obviously, this action would lead to another action or another situation where the proponents of nuclear weapons might withhold or be silenced or proposing nuclear weapons because they don't want to be shamed, and that will lead obviously to the outcome of not or removing the nuclear option table off the table. So as you can see here from this process, what you have is a process of mechanisms that primarily are identifying actions and actors. And with this, we can start thinking how process tracing works. Next, please. So again, what we're looking is in the relationship of case outcome, we're trying to really identify who are the actors that are entering into each of these mechanisms and what are the activities that each of these actors are involved in, so that we can really clarify how that chain of events might develop. Next, please. And here is putting a little bit like Humpty Dumpty together. As you see in the top of the image, you have the theoretical element where we have identified the actors and the activities that this would be engaged in our theoretical model. And then it's all about trying to find first the empirical propositions that would allow us to start thinking of testing of those propositions, and then the sourcing of the empirical evidence to be able to test those suppositions. Next, please. And here again, I give you another example. Here is an example of a coach or a teacher that is trying to increase the motivation or change the situation of their students. Here would be a very common causal theory of change, where you see, well, factors affecting the coach. For instance, the competencies of the coach, how motivated he is. Obviously, from the coach calling for voluntary participation, some of the participants might gain some insights, some might other gain insights in their competencies, others insights of the work that they want to do, other insights about the career market, and this might lead to a greater insight of the realistic possibilities in the future, etc. And as you can see here, we can see all the possibilities, but all of these are assumptions that are theoretical assumptions that we in process tracing you would normally test to be able to develop a sequential situation, a tested sequential situation. So like the one, next slide, please. The one that you would see here, but you will see now from a process tracing how the coaches would persuade the participants to participate in this event, where by promising them perhaps they help in the advancement of their career, or with related competences. Participants in this would relate the insights to the coach would reflect and would respond or retort to the participants about labor possibilities. The participants now would understand, based on that reaction from the coach, what are the options in terms of feasibility and their desirability. And as you can see here, you can see how the backward and forward generates the process of from one event to the outcome. Next, please. Now, in process tracing, normally we tend to use what is called a process tracing test, which is the testing for causal inferences. Some of them need to be present to affirm the causal inference. Some of them need to be also present, are necessary, and some of them are sufficient. And there are 4 types of testing: what they call the straw in the wind, the hope, the smoking gun, and the doubly decisive. Now, this, I find it a little bit complicated, so I'm going to do my best to try to explain it in simple terms. Asking ChatGPT about how to explain it to a child, AI me, ChatGPT gave me a very good suggestion. He says, well, think about solving a mystery. So a straw in the wind type of test would be, for example, finding a footprint near the scene. That is something that doesn't prove that you have done it, but at least, it makes one story a bit more likely. A hoop test would be, for instance, finding that a doorway where someone needs to be able to fit in. So if the person that you are suspecting to be committing the crime does not fit in, the person is easily eliminated. But if he does, it's not proving that actually caused it. So you start seeing different levels of causal inference. A smoking gun would be considered a big clue. For instance, catching someone with a weapon in the hand. So that would be immediately an element of like, oh, this is entering into a higher level of inferences. However, that doesn't mean that perhaps that person shot the gun. So again, it's just it's a different level of causal inference. And finally, the double decisive, that would be a dream clue that proves that one person did it and clears everybody else on the mystery. So again, thinking about health policy, we might be thinking of small things, for instance, a clinic that has a policy has been developed in the area, and then the clinic has more has a greater coverage. So was that result of the policy? Well, we don't know, but it goes in the same direction. So it's a small clue. A hope test would be, for instance, the policy might be implemented in those clinics that the outcome change, but not in the other where the outcome did not change. So again, this is a higher level of causal inference. A smoking gun would be, for instance, health workers confirm they receive the new funding and use it to remove, for instance, user fee, increasing again coverage. And finally, a double decisive would be where, for instance, where the funding arrive and the debt falls, and nothing else change other than those 2 outcomes. So this is something that it will fully confirm. Next, please. So I'm going to skip this one. So let's go to the next one. So there are common challenges in doing this. One of them is that it's always very difficult to get insider data, and this is common in all qualitative research. But again, here, given the focus on the sequences, sometimes it's difficult to separate sequences of events than just a coincidence. Like with every research, there is bias on the researcher in the building of the narrative, in the building of the models. And this is something that we cannot eliminate, we just need to become aware of. And then again, it's difficult to balance sometimes analytical depth, what we're doing, and the transparency. Next one, please. And so just to finalize, my last one is that this process focuses primarily on mechanisms. It's about triangulation of many different sources of data. It's about testing multiple hypotheses. Again, this explains how it works or why sometimes policy succeeds or fail. And it has very strong internal validity. And then again, if we are interested in external validity, perhaps in this thinking about the EPIC study, we have many different localities through which mechanisms can be explored, and we can start seeing perhaps patterns of mechanisms emerging on the different settings. Thank you.
Thanks so much, Carlos. And the final wing of this talk is about realist evaluation, which is the other obvious approach that we might turn to when thinking about evaluating a complex policy intervention. The Hollywood strapline for realist evaluation is that it helps you understand what works for whom, in what context, and why. That's a lot to promise people. At the core of realist evaluation is identifying what Pawson and Tilley have called context, mechanism, and outcome configurations. By context, they mean the social, institutional, environmental conditions in which an intervention happens. By mechanism, and this is probably the most important part of it, they mean the underlying processes that are triggered by the intervention in a context. And these are usually changes in resources, for example, funding, changes in reasoning, how people think about a particular issue, and changes in relationships, for example, in our case, bringing actors from different sectors together. And the outcome is the intended or perhaps unintended effects of an intervention when these mechanisms are triggered in specific contexts. And so, going back to my horrible diagram about theories, really context, mechanism, outcome configurations sit under a theory of change, and there can be many of them within a single program theory of change. So the theory of change for the program is setting specific, and within that you can have multiple context, mechanism, outcome configurations. So let's think a little bit about how that works in practice. Just two examples. The first is a realist evaluation of a modernization effort that took place across 4 inner London healthcare providers who were trying to make healthcare more efficient, more effective, and more patient-centered. So they did a big organizational case studies using realist principles, and they collected data using ethnographic observations, interviews, documents, and they tried to map and explore these context mechanism outcome relationships. And they did that in a participatory way by generating a big theory of change and then breaking that down into smaller components and mapping out context mechanism outcome relationships. Their evaluation identified 6 main mechanisms that drove the efforts of the change agents within the health system. And these were things like integrating services across providers, better finding and use of evidence, involving patients in the modernization effort, supporting self-care, etc. And what was very clear from this evaluation is that these different mechanisms didn't always work in the same way in different contexts, for example, in different hospitals or services. So some were activated to the full extent and some to a lesser extent. And that really explained part of the variation in outcomes that people also saw between these healthcare facilities. So this is quite an old evaluation, but quite a good example of how this is done. And this is an example from some of our work, and will be very familiar to Anthony and many others who have done a lot of work on community mobilization through participatory women's groups to improve birth outcomes, so reduce maternal deaths and reduce neonatal deaths. So we have an overall program theory for this intervention, which is that if you implement it in high mortality setting and with sufficient coverage of pregnant women, these participatory women's groups can reduce neonatal mortality. But how do they do that? Well, one context mechanism outcome configuration is described on this slide. So there is a contextual condition for this intervention to have an effect. Women need to be able to meet and talk to one another, because if they can't do that, they can't resolve any problems, they can't participate in any decisions. So in contexts where women cannot meet or deliberate, for example, in informal urban settlements where they don't have the physical space to meet or they don't have the time to meet because they're busy with lots of jobs, that contextual component isn't there. So the intervention sort of doesn't really happen. If women can meet and deliberate freely, then they can participate in collective problem solving, and that allows them to generate the first proximal outcome, which is that they start solving problems and reducing barriers to accessing prevention and treatment during pregnancy. And the distal outcome of that, which we observe in RCT and through other approaches, is a reduction in neonatal mortality. So the mechanism here can only be activated in a particular kind of context, which is a context where women can actually meet and talk to each other. So this is a very simple example. But you can imagine that in a complex policy intervention like EPIC, you have many potential mechanisms at play. You have models of governance, you have participatory budgeting, you have maybe children's participation in feeding into the policy process. So we're going to have to find a way to investigate these different mechanisms and the contextual the markers of context that are necessary to activate these mechanisms. So in the theory of change for EPIC, you identified six interrelated mechanisms that might improve early childhood development, and they're listed here on the slides. So if we think about our municipalities as cases, as Sarah was arguing earlier on, does that mean then, for example, that we have 10 case studies? And does that mean that within these case studies, we could explore these six different mechanisms and the contextual requirements to activate them and the different kinds of outcomes that they generate? Maybe. All of these are important questions because as you can see, this case study analysis is quite time and resource intensive. So Carlos, the focus on process tracing with really strong internal validity means that you need to collect quite a lot of data even within a case to be able to do the kind of testing that you're talking about. Similarly here, just because of the sheer numbers of potential case studies and the sheer number of mechanisms, we're dealing with a lot of iterative theory making and theory testing. There are some challenges that I think Carlos alluded to, which we can return to, and they're true for realist approaches as well. Gilmore wrote an interesting paper about the challenges of doing realist reviews in contexts that are not your own. And when we've got large teams across many different countries with power imbalances, this is a particular issue. So who gets to decide which mechanism is the most important or which contextual condition is the most important? How do power imbalances within the research team, our ability or inability to communicate with one another, influence that? Translation is another barrier that can get in our way of really identifying good context mechanism outcome configurations. Another problem that Gilmore talked about is the use and dependence on weird theories, theories that are generated in Western educated, industrialized, rich, and democratic nations, as opposed to perhaps theories that might make sense, might have been generated in other contexts that might make more sense locally, even though they haven't been formalized or written about. So I think what all these three approaches have in common, the cross-case comparative approach, the process tracing, the realist evaluation, is that they need time and attention to time, attention to the sequence of events to be able to infer causality. And they need a lot of thinking about cultural humility. Who is in the analytical team? Do we have the expertise, the experience to really be able to identify context mechanism outcomes, to know which mechanisms to prioritize? Sarah wanted to say something about time and how we might deal with that in EPIC, and then we'll close and have a discussion.
Yes, just very briefly, because a lot has already been said. As you will have noticed, all of these methodologies rely on understanding how events unfold over time. And so that's something that I think we should be keeping track of and thinking about starting now, because time flies when you're having fun. And we're going to be having a lot of fun with Epic. So, and Kwame he's just rolling his eyes because I'm always talking about how useful timelines and chronologies are. But yeah, I think the simplest way to track chronology is making a timeline. It can be really simple, but it captures key events in the policy making process, and it can avoid us making mistakes in terms of causal inference by saying something potentially caused something else when didn't even occur before it. So timelines, while they can be reconstructed retrospectively, I think I would suggest that we try to keep them prospectively for each locality. They don't have to be, it doesn't have to be very time consuming as a process. It's just keeping track of key events. So I put a template here with an example of you show the date, the event, the first steering committee meeting, a meeting with the local chief, the publication of some key document, and then you just write the source. Where did you, what can you refer back to say that this really occurred? And so it's as simple as that. And I think that although it seems basic, it will be really, really helpful in our analysis later on. So yeah, this is just a sort of shout out to simple timelines. Go ahead, Audrey, next slide, please. This is, I just thought this was a nice looking version from UCL PhD student Aaron Coe, just showing how things unfolded over time. We don't have to get into the details here, but this is something that we could put in final papers, and it'll look very different depending on what we want to highlight, but it can also track different strands of processes and events over time. There's actually a lot you can do with a timeline. So that's all about chronology and timelines for me.
Okay, so that concludes our tour of these three different approaches to evaluating complex policy interventions. We put a question up there, but I think initially we just like to invite any reflections or comments, thoughts that you have about these approaches, their strengths and weaknesses, or perhaps any experiences that you'd like to share about evaluating similar policy interventions in other places. I can see Raul managed to join us. Hopefully you're not driving, Raul. I hope you're staying safe.
I'm driving for sure, so I can do many things at the same time. This is part of the complex theory. No, don't worry, I'm not driving. Well, I will take advantage that I'm connected now to let you know that it was a very interesting presentation. Many things, a lot of things were new for me. And also what I feel is that I will need time to digest all the information that you have shared. And we will need to discuss within our group and also with your team in terms of trying to clarify the meaning of some of the strategies that you have presented or the models. Have have had some experience with the realistic evaluation based on an activity that I have participated with the Canadians. But again, this is something that we need to go more deep in terms of trying to understand what you have presented. Of course, as you can imagine, I have many questions in dealing with are we going to reach a unique model by the two countries? Are we going to apply the same theory at the different settings? So this will vary according to the contextual factor, as you have mentioned. So, I mean, these are some things that came to my mind, but just I wanted to share my first reaction to your presentation. Thank you so much.
Thanks so much, Raul. Yes, I agree. I think we all need time to reflect and discuss this further. And we all imagined that we would be doing locality-specific theories of change. But then whether we want to try to aggregate some of them or not is something that will need a lot of discussion. Anthony.
Thank you. That was really, really interesting. And this is a complex area. So just a few little comments that I noted down. The first, a quote that I often use is from Bertrand Russell, who says that for the natural sciences, chemistry, physics, maths, biology, the key outcome issue is energy. That's basically what everyone is studying. And he said the key outcome indicator for the social sciences is power, which is kind of interesting. So that's hold that thought for a moment. The second thing is that one of the problems I've had with realist evaluation is it is incredibly complex and right down at the local level. And I really liked your hierarchy, Audrey, of moving down from sort of Marx to realist Tim Coburn, Um, so um, but at the end of the day, okay, we can publish lots of nice papers in obscure journals. But at the end of the day, if you want to influence policy, you have to distill your findings down to something very simple. It's a bit like we've shown from a whole number of trials that you can reduce neonatal mortality by. We've shown by a whole number of studies that we can improve early childhood development because we've done this and that. It's almost the elevator pitch for policymakers. And so we have to think about that a little bit, how we can translate all of these complex theories into simple messages that might influence policymakers. Third point is one thing, and you may have mentioned this, I might have missed it, a comparison of good and bad outcomes. Wherever you go. So, for example, when I was in Nepal, this is nearly 40 years ago, the World Bank were intrigued because one district was reporting an infant mortality rate of 33 at a time when the national 33 deaths per thousand, when the national figure was 105. And everyone said they're making this up. And then Hopkins did a separate review and also found it was about 34. So they set up a study, which I was involved with, or a consultancy, to look at 5 districts and to compare them. And so we did go around and compare them. And sure enough, the key message was that the district, which was doing really well, had a very strong public health team, had incredibly good relationships with community leaders, and a great deal of involvement in local communities. And that brought home to me the importance of all of this at the time. So when we're doing, because you're going to be covering a lot of different areas, at some stage, you will have certain indicators, qualitative or quantitative, of areas that are doing well and areas that are not doing so well. And I think it's in those comparisons that you can start to distill out from all of the detailed realist or whatever theory of change type evaluation to draw some key messages out. Finally, when you did that slide, I think it was that you, Audrey, about the processes for ECD, and you had 5 things that you were measuring, the degree of participatory budgeting, child participation, etc. The one thing that when I think about Bertrand Russell's definition of power, probably the most important measure of power for early childhood development is the power given to parents. And I didn't see that marked there. I'm just thinking, what kind of budgetary power have they got? What supplements have they got? What better access to information have they got? What and what's the context which you will have looked at of different areas for them being able to look after their kids and give them more stimulation? And I would have thought that would be a very cardinal aspect of what you do. I'll stop there. But it's been fascinating discussion.
Thanks so much, Anthony. There's so much in there to unpack. I love the power quote. One of my hunches about the realist evaluation, and I've seen a few very complex ones unfold. So I'm aware that the catchphrase, understanding what works for whom, in what circumstances, it kind of obscures the fact that this is really resource intensive and quite complicated, and the power struggles that occur in theory generation. My sense is that people hide a certain amount of manipulation and epistemic violence behind the theory building. I'm not being very clear, but I think that in a lot of these evaluations, the theory building is often controlled by researchers sitting in the global north using theoretical models that they have drawn upon from their education. And so there is a relative lack of local engagement and transparency. And what is different about EPIC is that Flaxo and CLCD are deeply engaged and have high capacity to do theory building. And so whichever approach we end up taking, I think having it extremely locally led has to be has to be a key.
Just one comment on that. I gradually come back to the idea of the strength of anthropology. Really good person who understands anthropology, going and looking at deeply in relationships and all the rest of it, have often identified power issues subtly and all the rest, and often through very complex analysis, which help you to understand what's really going on. And they have to have local knowledge, local skills, and ideally local language and local idiom, you know. So I I'm I shifted a bit from anthropology to social science, but now I'm kind of back on the view that deep, in-depth anthropology is really good if you've got someone good at doing that locally, actually. But anyway, I don't know if you'd agree, Audrey, you're an anthropologist.
Yeah, it's still a social science. And yeah, I completely agree with you. Um, I wonder if anybody else has any thoughts, maybe from Flaxo or CLCD.
Pablo has his hand raised.
Ah, Pablo.
Thank you very much. It is really very, very interesting. You open a very deep and I hope rich sort of discussion which would strengthen our sights related with the project. What I was wondering in terms of my own experience in terms of dealing with the state policies, public policies in one hand, and the other hand, some outputs or outcomes related with population. Most of my failures, which were the most of my different intentions to change, was in terms of how strong are the state bureaucracies and the state ways of working and the difficulties to change those structures. Even through teaching, through different kinds of workshops, participatory techniques and methodologies, etc., the strong bureaucracies and how they function and how they impose limits are finally the barriers that I find can make more, at least in Argentina, the more challenging barriers we have to think how to overcome. So I think that in terms of processes, in terms of evaluation, which will be the steps in each municipality in different bureaucratic contexts how we start, what are they and we will try to move some things in the way they are doing to the way we want and they want to do it, and which results come up from those tries. I think it would be the most important thing, trying to find out finally, in terms of what Anthony said, how each power and the position each actor has in that bureaucracy moves or not move, and how we can try, probably during the period of the project, other tries. I think that we need to be flexible and right in terms to have a very good monitoring and evaluation process to find out what it moves and in what way in the time since the beginning till the end of the project.
Thank you, Pablo. Yeah, I can really relate to the comments about understanding bureaucracies and the constraints that they pose. It's bureaucracies are part of culture, and culture is the 900-pound gorilla in the room in all of these efforts. So we need to learn how to think like the system if we want to somehow make parts of the system change. And your last point is, I think, really nicely gelled with Sarah's attempts to get us all to do timelines. And we're going to have to work as a system to do this that doesn't drive everybody mad, to capture the kinds of things that you were saying. I wonder if colleagues from CLCD would like to share any experience. We also have Kudzai. I think Kudzai is joining us from Zimbabwe, and she's doing a PhD, which is a realist evaluation. I don't want to put you on the spot, Kudzai, but if you feel like sharing anything or asking a question, please do.
Thank you, Audrey. So as you mentioned, it was really great learning, and I'm looking forward to learning more from the PhD work that we'll be doing. And I think we'll be sharing notes through Vale from what our findings will be saying as we are applying the realist evaluation. Thank you.
Thanks, Kudzai. That's great to hear. There's a fair amount of experience around on doing these and the challenges of doing them. So we're happy to put you in touch with other people if you like.
That would be great.
I wonder if CLCD colleagues have any thoughts about the path that they would like to go on in terms of evaluation methods.
Right. I think for us the realist may work a bit in a sense that I think that National Steering Committee will be very interested in looking at what the context and what is working for who and for whom. I think they keep coming back to that over and over again. I didn't know that one existed, so I think it might be helpful. Because I think that's how we've been pitching, that we are trying to study how the different ones works, and then what made this one work and what the one did one work, and it seems like it resonates with them. But I wonder if when you are studying the mechanisms and the context, like still if some of the case studies kind of come in. I mean, obviously you need each of those places serve as cases in a way of highlighting different aspects of the mechanism or how it's working for whom. But yeah, that could work for us. But I don't know what my other colleagues think.
Hello. I agree with what Dr. Sechi just said. I think the realist approach will work for us.
Thanks both. Maybe as a follow-up, we should invite Dr. Nella Jeluli, who's done a big realist evaluation across many different contexts, to take us through the steps, so we have a sort of clearer understanding of what's involved, if that's something that you would like to pursue.
I think she may have just disappeared.
Would say? Yeah, that's okay. That was more of a general suggestion. I think if we want to dive further into realist evaluation, it would be good to have a sort of fully expanded example and case study of how that might be done. And I was going to suggest Nella Jaluli for that because she's done an amazing one.
Sorry, I misunderstood.
Kwame wants to make a comment.
Yeah, Kwame.
I wanted to ask, budget-wise, like which one is more costly?
That's a really good question,
It's
Kwame.
really critical. It's really important for us.
I mean, my feeling, listening to Carlos talking about process tracing, and the amount of data collection that's involved in developing a theory, developing hypotheses, rival hypotheses, testing these within a single case, having that for 10 cases, I could see that being quite quite involved, and requiring a lot of different people's attention. I think the realist evaluation might be somewhere in the middle. I suspect, and Sarah, you'll need to tell us that the cross-case comparative study is as cheap or as expensive as you want to make it, because it's really such a flexible approach. It's more about defining the case, and then you can sort of adapt the methods to explore the contextual and implementation factors. Is that fair, Sarah, or? We lost her. Great.
Sorry, I lost my window, but yes, I'm nodding. I mean, I think we're going to have to do that aspect of I mean, we'll have to compare across cases anyway. So yes, I think how long is a piece of string is basically the answer. So it's as long as our budget is.
Yeah. I think a lot of this, Kwame, is going to be about who does the theorizing,
Mhm.
and making, really thinking carefully about who is around the table for that, to kind of avoid the trap of external people misdiagnosing context and mechanisms. I think that's going to be really important. That doesn't tell you how expensive it's going to be, but
Yeah.
I mean, I think PhD students, to the extent maybe we can get them involved in this, they're going to be invested in
yeah.
putting in the time and the thinking. So that seems like a good possible matchup.
Can I
That's a
sorry, just ask one thing, just to whatever analysis and theoretical stuff you do, what are, if I was to ask you this, what are the three outcomes of all this work in Ghana and Argentina would you like to summarize at the end, just as a discipline? What three outcomes would it be about? Better budgets, better management, better parent power, better, I think it would be good to go through that discipline of really thinking through at the end of the day what kind of punchline you're going to get to be learned by other people in a simple way, and all the other complex stuff background.
Yeah, I agree, Anthony. And I guess that's what the research is about. It's about identifying those three things. I don't know if we can postulate, sort of before collecting the data, which of these things are going to be activated in which context, and that's part of the problem. So in some areas where the bureaucracy really supports it, the participatory budgeting stuff might really take off. In other areas, it might be something else. And I guess it's only through the cross-case comparison that we'll see which two or three kind of emerge at the top across the different municipalities. And that's my view, but Raul is going to set me straight.
Well, my question was related with Anthony's comment in terms of what will be, I don't know, as an externality or as a final result or as an outcome, which will be the best benefit, the most important benefit for each location, for each community. So I think that this can help the process of the deciding which will be the approach based on all the things that we are discussing in terms of the cost of the process, how easy it is to implement, and also which outcome will be important to analyze. I don't know personally what's the sense of introducing causal mechanism as Carlos has presented, considering how complex it is to introduce causality uh, for any project. So, and in social sciences is much more complex. So perhaps all the components will be a way to orient us to decide the better approach to choose. And in some moment, I would like an additional comment of the issue that you have mentioned in terms of cultural humility or something like that. So if you can clarify much more this concept, it will be helpful. Thank you.
Thanks, Raul. That's a tough question. So my reading around cultural humility, and we have, I think, Jivan, one of our PhD students here, who thinks a lot about this, is that it basically involves a commitment to reflexivity and to being self-critical in terms of our engagement with people from different cultural backgrounds. And by that, I don't just mean from different countries, I mean from different disciplinary backgrounds, from different class backgrounds. And the commitment to inclusivity and dialogue as part of that. So that all sounds really obvious, but if you're doing a realist evaluation, designing theories where you've got, for example, no healthcare providers, no people from creches, from local level involved in the theory building, we could miss some really critical cultural element. Or indeed, if one of us just sitting in London proposes a mechanism without understanding if it's even viable in an Argentinian bureaucratic context, that's a critical sort of lack of cultural humility. So it's basically that kind of commitment to being reflexive, to inclusivity, and to continuous dialogue. I think that's what I meant by that. Does that make sense?
Thank you.
Just on the public administration side, I mean, loads of people do masters and PhDs in public administration. They must have a big body of evidence, which I don't know about, or checklists for things that are indicative of better public administration and things that are indicative of not good. And is that being grappled with in this project so far?
Thanks, Anthony. Yeah, there is a large literature on that, and Kwame's just answered your question about the three things, which I think speaks to your point just now as well. Better governance/coordination, better incentives to prioritize innovative resource pooling. So these are your three things, Kwame.
Yeah. I think when we started doing the steering committee at the national level, this is not from me, but they said we need to figure a way of mastering the coordination based That's what the national people wanted to kind of figure out. When we got to the local level, it was all about resource pooling. How do they effectively kind of do that? What innovative ways or ideas that they can learn from to allow them to pull the resources that they need to get there? And then they also realized that there are different mechanisms for incentivizing the local governments to do. So the
Right.
funny thing that you saw in Ghana was it was the image of someone buying a car, but they're not responsible for driving a car. So the Ministry of Gender and Children's Social Protection owns the policy, but they're not the ones who implement the policy.
Mm.
And so at the local level, there are different incentives that is managed by the National Development Council. So they have their own set of indicators that the local government will do whatever it takes to be able to reach those and get their money or get their allocations. But it doesn't necessarily include early childhood development indicators per se. And
Mm.
so when you bring a steering committee together, they say, how do you get the early childhood, the most critical core ones, onto those incentives so that they can prioritize it, become more systemic so that everybody will be able to kind of do that. So those are the things that they are trying to kind of look for and find ways to be able to kind of address and learn from them. And there's a question that keeps repeating everywhere we go. So maybe those are the at least ideas from the ground.
Thanks, Kwame. That's great. I mean, it echoes some of the literature on challenges to ECD policy making from other contexts too, definitely from the Indian context that I'm familiar with. Carlos.
Sorry, I'm just going to go back a little bit into more generic, because I mean, I'm just trying to reflect a bit what this conversation has ignited in me. One of the things that I remember was, and I'm putting it as a metaphor, I remember an ex-girlfriend of mine talking to me about relationships. And she used to say, well, relationships are either long-lasting, intense, or, loving. And normally intense and loving relationships are not long-lasting. Long-lasting
Carlos,
relationships
do
that are
we want to
loving
carry on with this example?
usually not intense. So I think we need to realize that there are certain things that we need to let go. And I think using that kind of triad, we have multi-site research, and we want it to be in-depth and novel and complex, and I don't think we can have them all. And I think in this case, we have the multi-site, and this is something that we cannot just say, oh no, let's just focus on one place. We need to focus on 10 places. And I think that means that we need to turn it down a bit. And as I'm saying this, I'm becoming more aware that the process tracing might be just a big ask for this setting. And I think something like realist approaches might be potentially doable, but I don't know if we have the full capacity. And perhaps we even have to think of something simpler.
Yeah, I think that's very wise, Carlos. So maybe we need to kind of collectively learn and orient ourselves a bit more to realist approaches to understand if, as you're saying, this is just going to be sort of too deep across too many different places. And
Yeah, too complex to handle. Yeah.
Yeah. That sounds like a good next step. And Anthony is encouraging us to use measures of power of bureaucracy. Yes, so you're talking about the ones that the things that Kwame put up. And we can develop a ranking score. And it's all going to be on an index from 0 to 5. Fantastic.
Why not?
For a reductionist.
Quite right. Well, you have to have something simple at the end, don't you? That you
I
say,
got
look,
that message.
we've developed our lovely, detailed qualitative stuff, and we've got papers to back that up. But at
So,
the end of the day, we showed the stronger ones did better.
but that's what this kind of abstraction is supposed to do, right? Out of all of those program theories, you're supposed to come up with that mid-level, which I guess is, 2 or 3 of the core principal things that you need for this to work across different contexts.
Or how different contexts, what works in one context might not work in a different context. So that someone reading your paper will say, oh, well, it's, it's like this in my context. So this particular aspect could work. But we also have this different situation with respect to mechanism 4. So it's not even worth trying that one. You know what I mean?
Yeah, yeah, absolutely.
Yeah, and you want your name on a scale, don't you? The Kwame Rao Prost Dalgleish scale or whatever, you know.
Oh, Anthony, that's funny. No name, please. I want to be in my village.
All right. Any other thoughts? Lots of people we haven't heard from so far. Sorry, I realize this has become quite an epic-centric discussion. That's usually how these webinars go. Um, any other final thoughts? Okay. So I'll suggest that we do a bit of a deeper dive into realist evaluation as a next step and carry on the discussion. But I think this was an interesting start. I definitely enjoyed it, and we have lots to grapple with.
Audrey, can I just say this has been great? And one benefit is that I'm taking away is that we need to do exactly the same monthly webinars in the climate community. We were planning to do it, but we need to expedite it because you get really interesting ideas floating around, and it brings people together and stimulates us, annoys us, you know, but makes us think about what we want to do. So I think this is a really good format. I like it a lot.
Thanks, Anthony. And yeah, it makes sense across all of the different content sites. Just keep stealing ideas and people from us. That's fine. We don't mind.
Yeah. And remember always to keep your name on top of it.
All right. We'll be meeting in a few weeks, I think, as the whole EPIC team. But thanks to everyone who wasn't from EPIC for joining. We will make the slides and the video available for everyone. I think Shushmita and I will do that. Stay safe, everybody. Thank you for joining.
Thank you. Bye.
Thank you. Thank you so
Thank
much.
you so much.
That was
Bye.
very good.
Bye bye.
I'm not driving.
Thank
Bye.
you. Bye.
Bye.
Hi, Susmita.
Hi, Leonie. How
Yeah,
are you?
I'm good. I sent an email about us meeting to discuss the
Yes,
yeah.
that's why I'm here. I'm hanging on.
Okay,
Yeah.
yeah.
Okay, so let me share my screen.
Okay.
Let me just bring Prince. I'm going to remove you.
Okay.
Okay,
Yeah,
take care.
sorry.
Bye-bye.
Yeah, bye.
Bye.
Mhm.
Okay, let me just stop recording.
Mm-hmm.
Oh, there.